Thank you. Well, you just heard some economics in the form of art. Now you're going to hear it very differently. So that's sort of hard to live up to in that artistic form. So I'm going to talk to you about fiscal policies for health. And what we know is that tobacco, alcohol, sugary beverages lead to a number of chronic diseases, right? So we've got issues around lung cancer, cirrhosis of the liver, diabetes, obesity, and these NCDs are leading causes of death among the population, not just in the US, but worldwide. All of these, in addition, also have, for example, for alcohol, have other potential harms, traffic accidents, right, violence, sexually transmitted diseases, all associated with these harmful behaviors, harmful levels of consumption. And these have costs, medical costs, dental costs, productivity costs as well. And so economists think about how can we incorporate these costs into the price that you face when you're actually going to make the decision to purchase these products and consume them, right? Because the market price really doesn't account for those. And so this is what we call negative externalities. So we set these taxes equal to, as close as possible, to internalize these negative externalities. And so the idea that you can see on these boxes essentially is that the tax increases prices, which in turn reduces demand. And hopefully when you reduce that consumption, you're going to see some sort of improvement in the health outcome. But there are some unintended potential unintended consequences, and we also have to look at those. So do these work, right? So do we implement these? Yes, we do. We know we have tobacco taxes, we have alcohol taxes, we have a couple of sugary beverage taxes around the world, not many, and only a few here in the US. You may have remembered back in 2017, Cook County implemented a sugary beverage tax. It was fairly short-lived, just 4 months. But what we saw, as you can see from this graph, is that once the tax was implemented, so we had data over 2 years, and we implemented a pre-post intervention comparison site design study, and we could show relative to St. Louis, which was our comparison, that sales of sugary beverages fell. It's pretty dramatic. You don't even need the econometric models and the point estimates. You can just see it straight off the graph. It went down, and then unfortunately, the tax was repealed. For researchers, it was kind of a nice random event because we had another stick in our time series model, right? So we could show that it actually went right back up. And unfortunately, there wasn't even any learning. Sometimes these taxes can send a signal and say, hey, the reason the government's doing this is because it's not good to smoke or drink too much alcohol or consume too many sugary beverages. But it seems that in Cook County, we actually didn't learn much from the tax over those 4 months, and things went right back up, unfortunately. So why don't we see more of these taxes? I'm going to give you one example. There are many reasons. Industry raises, for example, the potential threat of job loss. And what you can see over time is that we actually haven't had any job loss. The 2 lines in each of these different graphs show for San Francisco and Philadelphia that there was actually no loss because the money doesn't disappear from the economy. It just gets spent on other things. So will we see these emerge? We don't have any at the state level or the federal level. So I'm going to just leave you with a question, and maybe would Illinois be the first state level tax? Thank you.